Did you know that 20 seconds could be the difference between remaining happy and healthy or potentially contracting some type of infectious disease? Simply washing our hands and getting rid of the microbes on the palms of our hands can be one of the easiest things to do to stop the spread of these germs. This is really relevant in our day and age because the coronavirus has taken over our lives in the past couple of months. It's taken us out of school, locked us in our homes, and thousands of people have gotten severely sick because of it. After extensive research and having experience in the medical field myself, I've learned that one of the easiest things we can do to stop the spread of germs is washing our hands. Today I'm going to show you the importance of washing our hands and why we all should be diligent in doing so. To begin, I'm going to explain the ease in spreading germs in our daily lives. So according to the Centers for Disease Control and Prevention, many diseases and conditions are spread by not washing hands with soap and clean running water. Microbes will accumulate on our hands after we use the restroom, after we change a diaper, or maybe handle raw meats. And these invisible microbes will remain on the palms of our hands, and we can easily transmit them to public surfaces, such as a countertop or a doorknob, or another person if we shake hands with them. Then these microbes will cause some type of infection in our body because we frequently touch our face as humans. Maybe that's our eyes, our nose, or our mouth, and this gives the bacteria causing disease a leeway to get into the body and cause some type of internal problem. Whether or not we're tolerant to different types of pathogens, we are still responsible for the microbes that remain on the palms of our hand that we might transmit to a public surface that could be passed to somebody else. Humans with underlying medical conditions are more likely to contract some type of infection because they have a compromised immune system. Also, younger children and the elderly have a harder time fighting infection because their immune systems aren't fully developed or their immune system is degenerating with their age. It's our responsibility to take care of ourselves and make sure we remain healthy. But also, let's make it our responsibility to make sure that the people with compromised immune systems are less likely to contract some type of illness from the microbes that we spread on our hands. If we prevent the spread of germs on our part, this could potentially prevent someone with a compromised immune system from contracting an illness. We should think about our grandparents, or maybe a younger sibling in our family or a cousin that has some type of medical disorder. We wouldn't want them to get severely sick because another individual forgot to wash their hands after using the restroom. So now that you know the importance of stopping the spread of germs, let's talk about how easy it is to demonstrate good hand hygiene in our everyday lives. So we simply need to wash our hands after encountering a microbe-filled surface, whether that's a countertop again, or a doorknob, or when we're at the grocery store. And we can do this by using a public restroom or a restroom at our home with soap and water. Also, we can carry around a travel-size hand sanitizer bottle that will do the same exact job. But according to the CDC, there are 5 easy steps when we want to wash the living bacteria off the palms of our hands. And first, we need to start with wetting our hands and then lathering soap on our hands. We need to get the backs of our hands in between our fingers and under our fingernails. After about 20 seconds of scrubbing our hands together, we need to rinse the soap off with warm running water and dry our hands with a clean paper towel or air dry them. You might think that maybe you're in the comfort of your own home, good hand hygiene isn't as significant, or you don't have enough time, you're in a rush to work or you're in a rush to class. But transmission is so easy. For example, you might have microbes on the palms of your hand and you might go to open a door in your own home. You transmit these microbes to the doorknob. Your sister might be working in a nursing home that afternoon and she touches the same doorknob and now she has the microbes on her hand. She might go into work and before practicing good hand hygiene, she touches a countertop that later in the day a different resident will come in contact with. This resident in a couple of days might develop some serious respiratory illness from the microbes that were living on your hand at the beginning of the day. As crazy as it sounds, this is how bacteria spreads and how easy infection begins. So 20 seconds is the quickest time that we can take to prevent the spread of these germs. Sepsis Alliance states that up to 1 million deaths per year worldwide could be prevented by routine hand washing. So now we know why we need to stop the spread of the germs. Now we know how to demonstrate good hand hygiene in order to stop the spread of germs. So let me explain to you what happens when we don't practice good hand hygiene. So how do illnesses affect our everyday lives? And what can 20 seconds by washing our hands prevent? Certain infections such as the flu take students and employees out of work every single day. And according to Dr. Brennan from WebMD, the flu cost Americans 17 million missed work days, which translates to $7 billion a year in sick days and undone work. And this isn't all. Sometimes sometimes infections, we believe that they only last a couple of days and an antibiotic will do the job and clear it right up. But certain infections such as trachoma is a bacterial infection of the eye, and if it's not treated properly, it could lead to blindness. Or Staphylococcus is a bacteria that's very commonly found on our skin, but if we have an open wound, this bacteria will penetrate the soft tissue of our epidermis and affect organs, joints, and bones. To conclude, we must do our part in stopping the spread of germs by simply washing our hands. So the next time you make dinner for your family or you use the restroom, I urge you to remember how easy it is to spread germs, but also I urge you to remember how quickly it takes to stop the spread of germs. Every day I make the decision to practice good hand hygiene, not only to protect myself, but also to protect my friends and my family and the people I'm in close contact with. So before you make a beeline towards the exit of the restroom because you're in a rush to get back to work or to get back to class, I urge you to consider the consequences that might not only affect you or a loved one when you avoid spending 20 seconds to practice good hand hygiene.